Welcome to our small healthcare provider privacy and security Google Hangout. We're pleased to be joined by Robert Zimmerman, Managing Director of Health Information Technology at QIP Solutions, and Anna Gard, Health IT and Quality Consultant with the Association of Clinicians for the Underserved. I'm Mark Silverstein, the moderator. Let's jump right into this. Robert, you recently moderated a panel discussion titled "Why Risk to Small Providers Pose a Risk to All?" And Anna, you were part of that discussion. Let's just start with that question. Why risk to small providers pose a risk to all? Why is that the case?
I think there's a couple of reasons. One is there's generally a focus in healthcare, and especially whether it's the government level, insurance companies, others, to focus on larger providers, believing that's where the risk is. There's this concept that large means high risk. However, when you look at technology, and especially as we move to an integrated world, integrated environment with exchanges, mobile health, etc., small providers are going to be interconnected with the larger providers. And a risk to the small provider, as you mentioned, is a risk to all. And it can be just as serious. There's a general focus of saying, let's focus on the large providers. But if I'm a hacker, I may go to an organization like University of Maryland and see if I can get in. If I don't, I'm going to quickly go where I believe the weakest link is, and we know it's small providers. I've been in a small provider where we sat down, we logged in, and there was no security, and we got right into the network. So anybody could do that. And once I'm on the network, if I'm interconnected with an exchange or with one of the larger providers that really is involved now with small providers, I'm in their network also. So there really is a risk to all. And then I think Anna can talk about from a patient perspective, there's a risk because if patients start not having the trust in the small providers, they're going to start migrating just naturally to larger providers, hospital systems, etc.
Yeah, I'd like to add to that. In terms of patient quality and safety, if patients fear that their privacy and security is not protected at their healthcare providers, they may start to engage in what we call privacy protective behaviors, meaning that they won't necessarily share all of their health information to the provider, which in itself puts the quality of their care at risk if they're not freely providing all of their medical history and their symptoms. So that in itself compromises safety and quality. They may also not continue to follow up for their regular care, particularly when it comes to chronic disease management. So then you have patients who, because they're reluctant to go to their care provider for fear of breaches, they're not going to go regularly, which means that their chronic diseases may go uncared for. And then they end up either in emergency departments or they end up hospitalized because their chronic diseases have gotten really complicated. So it also creates a much greater burden on the healthcare system in terms of costs. In terms of...
Let me jump in there because I want to bore into that point you're making, which is people are more concerned about their privacy than their health. So much so that they're going to let it affect how they attend to their health.
Absolutely, particularly when you think of, for example, someone who is HIV positive. They may be more concerned about protecting the privacy of that status than actually addressing their health-related issues. Because if that gets out, particularly in certain communities, that may mean that they get kicked out of their church community, that they may be at risk for job loss, they may be ostracized from their families. So the repercussions are so great that they would put their health at risk in, as a means to protecting their privacy.
You broke up a little bit there, so I just want to go over one quick point you made there, which is that they're more concerned about their family or their employers finding out about it than so that that's why they put their health at risk.
Absolutely.
Okay. Now recently we talked about this a little bit about the Health Privacy and Security Forum that you both were recently at in Boston. On the same day that you were there, the HIPAA high-tech omnibus rule went into effect. That was on September the 23rd. What are those requirements? What are the HIPAA high-tech requirements so people know? And are most small providers, are they in compliance? So tell us what the rules are and tell us if you're finding small providers in compliance.
Okay, I'll start backwards actually because I think it's important. The requirements have been out for a while and now they are finalized. But what's really surprising is it's not just small providers. It's a lot of providers, whether medium size and down, and even some of the larger providers who have had audits have been found not to be compliant with the regulations. So it's something that really is throughout the healthcare system. Part of the problem is security, privacy is not the focus of most individuals in healthcare. Their focus is patient care, research, etc., which you might expect. So when these regulations came out, there was a natural tendency to say, okay, I'll do them. The government had an approach, especially around meaningful use and the security rule that's tied to that, 15, of giving incentives to try to incentivize people to follow them, to get those basic type of security and privacy in effect, get the notices out, have a basic risk assessment, which is really required. Then came the HIPAA high-tech, which got much more involved in the security area of basically really looking for organizations to adopt good security and privacy practices, policies, procedures, remediate, etc. But what's been seen out there is it's a little bit overwhelming for most practices. They don't necessarily have a security and privacy officer in place. And matter of fact, you'd be surprised. We were just talking to a clinic that has almost 250 doctors, well over 1,000 staff. They say they see at least 80,000 patients a year, and they are basically just trying to wrestle with security. They don't have a security officer. So this really goes throughout the healthcare industry. The problem we have here is people focus on the large hospital centers, and they do have security officers. So this is something that really is becoming an issue. I think the latest statistics showed well over 90% of the providers, especially as you move into the medium and small size, were not compliant. There's a couple of reasons with that. One is, as we mentioned, the difficulty. It's an area they're not familiar with. What's been put out there is overwhelming to them, and we'll talk later about what they really do need. And then the other thing is they need to know why they're doing this. If you talk to doctors, they go, what's in it for me? I mean, it's a natural tendency. How's this going to benefit me? How's this going to benefit my patients? And when you start talking about the risk piece, not compliance, they get it. But unfortunately, it's been a push on compliance, and that does not excite doctors. They're so tired of compliance, whether it's Medicare, regulatory compliance. But when you mention there's a risk to their financial operations, there's a risk to their patients, there's a risk to their reputation, they get it, they understand it. So I think what's needed is just kind of a change in focus from compliance to risk.
And Anna, you work in the field with clinicians from community clinics, nonprofits, and hospitals. What specifically are you hearing from them? What are they telling you, in person that they're essentially, I guess, admitting to?
Right. I think their greatest challenge is to keep up with, adjust, and digest the flow of information that's coming at them in terms of adoption and implementation of health information technology. And along with that comes the security piece and the privacy piece. And so, as Robert had mentioned, many smaller community-based practices don't have dedicated IT staff. Typically, the office manager or the director of operations is the one who takes on the EHR project, and they become the project manager, and then by default are also nominated as the compliance officer for security and privacy. Not to mention that they may also be in charge of facilities and HR. So they put on multiple different hats. At the same time, they're trying to get all of their staff up to speed on their electronic medical record, meet meaningful use, They're also trying to meet maybe patient-centered medical home standards. So security and privacy really gets kind of pushed off to the side because they themselves don't necessarily consider themselves at risk, that no one's really going to look at them.
So wait, they're like, oh, it's the big guys here. I really don't.
Right.
We don't have to worry about us.
Pretty much. And I think it also goes with we tend to adopt technology much more quickly than we think about the impact and outcome of technology. So, I mean, every time you get, when you went from a PDA to a cell phone to a smartphone, you started using it before you really figured out what the privacy and security settings were. Same thing with social media, Facebook, Instagram, all of that. It's cool, it's hip, it's fun, let's use it. And it's kind of an afterthought about privacy and security. And I think that's kind of what's happening in these, really in healthcare overall, but particularly with smaller to medium-sized practices. And then they're playing catch-up. And they don't have the skill set or expertise specific in IT to really understand the intricacies of what it means to set up secure HIT practices.
Well, I mean, I guess the next question just becomes, so what do you do? I mean, we could bore into this some more. I mean, one of the points that always is made to me is that, I mean, their health information is worth 50 times a credit card. Isn't that something?
Right.
That's true. That's very true. Because of the fact that people love to talk about SSN and that kind of thing, but Social Security number. But the real thing is that medical ID, which can then be used by individuals throughout the country, and that's really how they normally do it. Is they may be an individual from Maryland, but they'll go and sell it to people in Arizona. Well, it's normally going to take 30, 60 days before anybody realizes that somebody has used this for procedures, et cetera. So it can be extremely costly.
Well, how's it used? I mean, if I sell it to, as you said, if somebody sells it to somebody in Arizona, well, how do they
normally what they would do is when you go in, and I've had a lot of experience recently with emergency rooms for personal, is you'll go in there and the first thing they ask you is for an ID card. So you present them your ID card. They really don't ask for any other type of ID. It's just, where's your insurance? So you provide that insurance, you give the name of the individual on there, and then you get whatever you need, whatever services you do need. You can also use it then for prescriptions and so forth. So it's easier than you might think to do. Obviously, hospitals and other people are starting to realize this, but in medicine, as Anna knows, the first concern is let's help this individual. They come in, they need something done, they need a procedure done. You'll take the information, but normally it's not the first thing to go check and validate everything. So, and that's probably the way it should be. So, but it does open up the avenue for fraud.
Yeah, we don't necessarily in healthcare settings ask for photo IDs to verify that you're the person that's on the card. And there are some complications related to that when you're talking about vulnerable populations, migrant health, healthcare for the homeless, public housing, where some individuals may not necessarily have a photo ID. So I mean, that's why it's very easy to, really commit insurance fraud.
Robert, you talked about the penalties. Just give people an idea. What kind of penalties are they looking at, these small healthcare providers?
Well, honestly, there are penalties, and I know they were recently raised, and HHS, ONC, and OCR like to emphasize the penalties. Unfortunately, that's really not a driver for most providers because they don't believe they're going to be audited. But they do go as high as $100,000. There have been practices fined up to $1 million. There was a practice, but then the bigger cost is the loss of reputation, the remediation work you've got to do. If you have to send out any type of credit notices and provide credit monitoring. If you get the reputation that you're not protecting people's privacy, you're going to lose patients and revenue. So that is the driver. For most providers, we're seeing it's not the potential fines. So they're starting to realize they need to do something for that reason. And what they're looking for is a straightforward approach to get those basics, because they do realize, I mean, they read, doctors, medical staff read, they hear about breaches and technology, but the problem is that everything's been provided to date has been very focused on large organization. It's overwhelming. What they need is a very simplified approach that just carries them through the process of being compliant. What are my critical risks? Not all my risks, but what are my critical risks, and let me focus on them so I can be as protected as possible at a cost that is reasonable for my practice, because they're going to use the old cost-benefit analysis like they always do. And then the thing that isn't realized a lot, and I do want to bring this up, and I know Anna can add to this, is that most problems in security and privacy are caused by the human element. It's not technology, and there's a general philosophy, and because of government and big and everyone else is saying cybersecurity, cybersecurity. But the big cost in healthcare, and I think industries in general, is that human element of people leave their laptop or PC on. They don't follow the password procedures. They lose a USB port. They take a call from a privacy perspective and they're trying to be nice and they give information they shouldn't. They find out that there's a celebrity in the hospital and they decide, hey, let me find out what's going on with them. These things happen every day.
They lose a phone. They lose their phone.
They lose their phone, any of that. So what's really needed is very straightforward, simple processes and procedures they can understand that can be implemented. So that's really a key ingredient, is just focus on what are those risks that really do occur, and then let's get in some good policies, procedures, processes in place, supported by technology, to reduce the risk to the practice.
I would also like to add that there's a component of education that's really important, is that I think oftentimes, since human error is the biggest cause of breaches, that there's a lack of awareness of what's considered a breach. Or, for example, I just heard a story yesterday of a woman who went to see a surgeon for something related to an injury to her finger, and the surgeon said, "Oh, let me take a picture of this," and wanted to start, texting himself some notes about it. And she said, "Wait a minute," because she happens to be a COO of a healthcare organization. Is that encrypted? I'm not sure you haven't asked for me to sign a consent. Now, she is the rare person who would do that. And here's a practicing surgeon who should know better. But in fact, I think we realize that, again, it's that matter of adopting technology so quickly because it enhances our workflow and it helps us do our job, but not really considering the repercussions or what we need to put in place to keep things private and secure.
Just anecdotally, I had a minor procedure and I tore an Achilles, and later I came back to the doctor and he showed me on his phone my operation he took, and he told me what a great job I did while I was under anesthesia. But what if he had had lost that phone, or I mean, I don't think it would have identified me. But those are the kind of things people are doing. Between social media, I mean, that's another way, I guess, that people are always so happy to share everything. So you talked about some kind of solutions there, Robert, but can we get more specific?
Yeah, we have a solution, HIPAA High-Tech Express, and it was really developed under the premise that security and privacy did not have to be complex. There's a tendency for people to want to make this into something complex, use big terms, etc. And our whole idea was to go against that paradigm and say it could be simplified. It could be designed so that the average practitioner, medical person, nurse, whatever it might be, office administrator could do it. So what it is, basically, it's a SaaS-based cloud solution that provides everything all in one. And that's really something we've heard out in the industry. People are looking for something very simple, straightforward. It's almost a TurboTax for security and privacy that they can use. So we provide training elements, very straightforward videos. We have a risk assessment. Instead of being a 200 or 300 question risk assessment, it's 40 questions focused on what's really important. It drives a gap analysis and then actual remediation, because what we've seen out there is there's a tendency to do the risk assessment but never remediate. So you really haven't done anything to really help your organization. So we drive it through.
Wait. So they do, they go, okay, this is at risk, and then they just give up?
And they stop. Well, it's not really giving up. Unfortunately, there's been a lot of mixed messages from the government, and they're focused on certain things like risk assessment, so people pick up on it. Vendors have focused on the idea of risk assessment and focus on it. But anybody who's really been in this industry a while realizes that's just the first step, and what you really have to do, it's the harder part, it's the remediation and putting that into common practice. And that's what reduces risk. And that's where we're focused, is really helping the organizations reduce risk by putting in policies in place, identifying, here's some vulnerability scans that you need to use that you're not using. Here's some ongoing monitoring. If you don't have a good password protection policy, here's one, and here's also how to implement it so that you can actually put it into practice. And if you're a provider, you can oversee your vendor if you bring in a vendor, because you have the basic understanding. So we're giving organizations, here's what you need to do. It's a how-to guide to really reduce the risk and continue the ongoing monitoring. And then what we've recently added, because organizations in healthcare love insurance, it's very common, whether it's patient insurance or liability insurance, we've added breach insurance, breach protection. So it's basically to help them if they do have a problem, pay for some of the basics, the notices, etc., that are required. And we really have two kinds. It's breach protection, which is very basic, covering your cost, and then insurance, which will be more full and cover any other issues that you might have, including legal issues, etc. So what we've tried to do is make this very straightforward and simplified, because that's what people are looking for. I think Anna mentioned a couple times, technology can be overwhelming. There's so much out there. There's so much for these people in the medical field, and when you talk to doctors, nurses, I think they understand the importance, but it's almost like if I was asked to fix a carburetor. I could go out on the web and get a how-to guide, or at least get some information, but I'm not going to really be able to do it without some assistance or a real guidebook. And that's what we're offering to the medical industry, is a guidebook of how to really be protected, compliant, and auditable if you ever were audited.
I'd like to add, too, one of the values of HIPAA High-Tech Express really meets the need of many organizations who don't have the staffing to do the actual risk assessment or the remediation, and as Robert said, or have the depth of knowledge to understand the how-to. And so we think of HIPAA High-Tech Express as having this on-demand virtual privacy and security officer that is available to your organization when needed, because you don't necessarily have the staff in-house. And this is a real value for many practices, because it meets the need that they have without having to take on the burden of hiring a compliance officer, which is not necessarily in the organization's budget. So that's the real value when we're talking about a shortage of trained providers with the time and the knowledge to do what needs to be done to make sure your organization is meeting compliance.
What's the response been?
I'd say the response has been very good. People who see it, the comment we get is, geez, this really is straightforward and simple. We're talking to a CIO of a large clinic, and she said, this is exactly what I'm looking for. And Anna hit it on the note. She said, I've been looking for something that can be our virtual security privacy officer. We really can't afford to have somebody full-time. We don't think we need it, but we really do need that guidance. We need somebody and a solution that will help us through the process. And then what we offer is that guidance. So if you have questions, you can come to us. If you need some consulting help on difficult technical issues, we're available. But instead of that person being full-time, it's kind of on call and as you need it. And it's almost bringing back to the days of the house call with the doctor, of saying, when you need it, we're there, and we come, and we'll come and help you. and then we'll go off. And then when you need us again, we're there, whether it's by phone or webinar or in person, to help you. So that's the concept, and it seems like it's connecting very well with the industry, healthcare industry, because it is kind of familiar to them. The approach that they use, same idea when you use specialists. The person's there when you need it, then they go away, and the general physician handles a lot of it. So the concept fits in very nicely with the medical industry. So we've had very positive feedback to date, and it looks like it's something that's really needed.
I think the momentum is continuing to grow, particularly as we progress with health information exchange and ACOs, that small or medium-sized practices will not be invited to be a part of health information exchanges if they're not considered secure and private. And so that they need to demonstrate not only for their own regulations that they have a secure and private organization, but they need to demonstrate that to be invited to participate in a health information exchange so they don't put the other organizations they're exchanging with at risk. So I think as healthcare is changing and healthcare reform and ACOs are developing and we're really moving forward with health information exchange, the demand for HIPAA High-Tech Express to really support practices get into compliance will continue to grow.
And we just to follow on to that, we just got a request from an organization in Texas that we had worked with in the exchange, and there's also a number of providers tied to it. And they were mentioning that they had gotten a request from Texas Medicaid as to their HIPAA compliance. So we're even seeing now organizations like that reaching out to providers and saying, are you HIPAA compliant? And something like HIPAA High-Tech Express is a very easy way to become compliant, but then also because it has been designed by auditors, people with audit experience, it provides everything that very quickly you can show an auditor, here's what we got, we are compliant, we're on our way, we're making an effort, and it will not disrupt your practice. And I think that's the key part. It will not disrupt your practice during an audit because we're providing everything in a nice format for auditors. So the nice part is they said, can you help us? And we said, great, yes, because everything is already there. It's just providing it in a nice format back to the auditors.
You made a point earlier, and I want to make it clear. So it's not a one-and-done situation. You got, as a small provider, you have to stay current. This is a HIPAA High-Tech Express will keep going. I mean, the vulnerabilities remain, so you got to get in there and stay current. Correct?
That's the idea, and that's why it is subscription-based. And we really think there's a plus to it. I know in the medical industry they've been slow to adopt cloud, especially larger organizations, because of perceived risk and loss of control of data. But for this application, because we're really not holding PHI, we're holding a lot of information that talks about it and drives it and controls it. It's a perfect application for SaaS-based, cloud-based solution because we can keep it updated. You're right on. The regulations change, we can update it, everybody can use it, they get the latest policies, procedures, regulations. It's sitting out there every year. When they come back, all the information is in a nice repository that they can use and their whole organization can use. So it's there every year on an ongoing basis for them in a format they can use, because what traditionally has happened in the industry, and it's not just healthcare, people go through these fire drills every year, let's become compliant or let's get ready for an audit. But with HIPAA High-Tech Express, it's there. All you have to do is update it each year if you need to, and you're ready for the next year. So it's an ongoing process. And
additionally, health information technology is rapidly evolving. So your organization this year may not necessarily be involved in telemedicine, but next year it is. And so with every year, as you adopt new forms of technology to engage your patients and improve the quality of care you're providing, you need to continuously monitor, are you implementing security and privacy practices with adoption of each new technology?
All right, is there anything we haven't touched on? Last thoughts?
No, I think just in a quick summary, that I would offer up is that there are a lot of providers who have kind of been waiting and wondering, should I do anything around meaningful use security rule and the HIPAA security and privacy rule? And my answer would be yes. Don't do it necessarily for compliance. Yes, you want to be compliant, but do it because it benefits your practice. It benefits your patients because it will reduce the risk of a wrong diagnosis or their information getting out. And it will benefit as we move more and more to exchanges and other individuals who you do interface with.
And I'd just like to give a plug that we are providing a webinar jointly co-sponsored by the Association of Clinicians for the Underserved and HIPAA High Tech Express on Wednesday, October 23rd at 1 p.m. Eastern Standard Time. The focus is on becoming HIPAA High Tech compliant, identifying and managing risk, particularly in vulnerable populations. So you can get more information on the ACU website at www.clinicians.org or also at HIPAA High Tech Express.
Anna read my mind. She plugged that. Robert, what do you want to plug?
I beat you to it, Robert.
She plugged us both, so we're happy.
Well, where do people get in touch if they want to know more about HIPAA High Tech Express?
Oh, okay. For HIPAA High Tech Express, if you are interested in learning more information about HIPAA High Tech Express and other simplified solutions or just hot topics, you can look on our website, qipsolutions.com. We have a blog. We also have a lot of thought leadership and ideas on how you can better protect your practice.
Robert Zimmerman, Managing Director of Health IT at QIP Solutions, and Anna Gard, Health IT and Quality Consultant at ACU. Thank you.
Thank you.
Thank you. Have a good day.
All right.